So what's your reaction to this possibility? Do you think this is a good or a bad idea?
Anna, one of the things as a cardiologist that we've been incredibly concerned about is the burgeoning obesity in this country, diabetes, hypertension. All of those are risk factors that do what? Lead to cardiovascular disease. Heart disease is the number one killer of Americans, it's the number one killer of women. And so we've been very concerned about why this continues to be the number one killer. Certainly, food is a big part of it. And we know that 80% of all heart disease is actually preventable. It's not genetic.
Well, some would say, this sounds really insensitive that they're not going to let people who are on food stamps be able to buy the food that they want to eat. But can you talk a little bit about how things have changed in our history? I've studied community health when I was in college, and back in the day, it used to be that when you were poor, you couldn't get enough to eat. And now when you're poor, very often, because the foods are so, high in calories but low in actual nutrients, there's an obesity problem for people who are in poverty.
And Anna, you're absolutely correct. There are two sides to that coin. People still don't get enough to eat. They're getting empty calorie foods that are not nutrient dense. And when we look at both sides of that coin, very well intended. However, there are still people, especially those in rural America and some areas on the margins of urban America, that are in these food deserts, and you really only have access to what is available to you. We have to remember that 25% of people that are utilizing food stamps are disabled, another 20% are elderly, 40% are children. So we have to take into account all of these things. Additionally, this is actually being used as money, and fruits and vegetables are so much more expensive than cheap food. And so that still doesn't correct for how are you going to have enough food stamps to buy these fresh items. And so all of that it seems to still need to be worked out.
Yeah, I mean, it sounds like right now it's just an idea. It's just something that's sort of being proposed and getting hammered out. But you're right, something ought to be done in tandem as well to try to help these folks get fruits and vegetables and make them accessible and not so doggone expensive. Maybe they can pair with local farmers or something and help out them, because we know our farmers need some help too. RFK Jr., the newly confirmed Secretary of Health and Human Services, has been highly critical of vaccines and the health of Americans, having this to say. Listen.
We literally have the sickest population in the world. Those are the people that got us there. We do need a break. We need somebody different who can come in and say, I'm going to be a disruptor. I'm not going to let the food industry and the pharmaceutical industry run health policy anymore.
So when you look at the numbers and everything that you know as a doctor, do you agree with RFK Jr. that America has the sickest population in the world when it comes to developed nations?
And so that depends on how you slice it. That's a little bit of hyperbole. We are a very westernized nation, and our sickness is very different from other countries who are sick with all types of diseases. We are sort of sick with an overabundance. So it's difficult to compare apples to oranges. But I will say this. Heart disease remains the number one killer of Americans, and a lot of that is a self-inflicted wound. It is how we live, how we are developing our food chains, how we're utilizing those food chains, and that is something that actually we need to take a very close look at that and see what can be done. Because as you rightly stated in your study of community health, it seems that in the past people didn't have enough food, but actually that's what's happening. It's a smokescreen. We don't have enough food. We're having empty calories, and that keeps you continuing to eat and graze on more and more and more processed and non-nutritional foods.
Yeah, and we got to get in the school cafeterias too to teach them young how to eat. And I could talk about that forever. Thanks for watching. Go to joinnn.com to find News Nation on your screen, and don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.